Chlamydia, what are the symptoms? Could I potentially have it? How is it diagnosed? These are the questions that we answer at My Health Spot. So what is chlamydia? Chlamydia is a bacterial infection that can occur when we have unprotected sexual intercourse. It is one of the most common STDs, and about 4 million cases in the US are diagnosed per year. Most actually are without symptoms, known as being asymptomatic, but still infectious. If somebody feels just fine, looks fine, and doesn't seem to have any problems, they can still acquire the infection through sexual intercourse. And the other key point is actually ejaculation is not required to spread the infection. So what are the symptoms of chlamydia? Symptoms, when they do occur, can be confused with vaginitis, which is going to be change in vaginal discharge, intermenstrual vaginal bleeding, as well as bleeding after sex. When you go to the doctor, the physical exam is rather unremarkable, and actually you might look completely normal. Incubation period can be around 7 to 14 days, but it's actually unclear if you are asymptomatic when you acquire the infection to begin with. It can be up to months to even years since you had the infection. The second thing besides cervicitis can be what's called urethritis. The urethra is the last part of the urinary tract system as it exits your body, and can develop symptoms very similar to urinary tract infections, which is going to be dysuria and pyuria, meaning dysuria with pain with urination, as well as pyuria, which is going to be pus in the urine itself. About 25% develop urethritis and can be confused with a urinary tract infection. The difference and the key point is on the testing. On urinalysis, which is a very typical test done for urinary tract infections, you'll find what's called pyuria, also known as white blood cells, in the urine without evidence of bacteria, and the urine culture will actually be normal as well. Now, cervicitis progresses to pelvic inflammatory disease. This means that the chlamydia has actually spread to the actual pelvic organs themselves, including the uterus, the fallopian tubes, and maybe even further. The rate is about 2 to 4%, but likely the incidence is underestimated because in PID, with chlamydia specifically, that the symptoms can still be asymptomatic and only found later when somebody goes to the doctor because of infertility. The exam findings when you go to the doctor might have what's called cervical motion tenderness, meaning that when the uterus is moved, there's pain, as well as pain around where the ovaries typically are found. Complications of pelvic inflammatory disease can include various things, including tubal infertility, meaning that the cause of infertility is found at the fallopian tubes because the scarring of the fallopian tubes is too much in order for an egg to pass. Because also there's scarring of the fallopian tube, you can actually have what's called an ectopic pregnancy, meaning that if you do become pregnant, then the pregnancy can occur in the fallopian tube, where one, the baby won't survive, and two, can actually be life-threatening to the mom. And the unfortunate consequence of pelvic inflammatory disease can be chronic pelvic pain, which patients typically will describe pain that's severe, oftentimes requesting for narcotics, and is a very bad complication. Now, complications occur more often with chlamydia than gonorrhea, specifically because chlamydia goes silent for so long that can have an infection for so long that you will actually have problems, whereas gonorrhea typically will be more of an acute infection and you'll actually know right away rather than for months or years if you have an infection. There are some other conditions called perihepatitis. There's a long name called Fitz-Curtis syndrome, where it's actually thought to be a progression of PID, where it includes inflammation of the liver itself. Symptoms can include right upper quadrant pain as well as pleuritic pain, known as pain with deep breathing. The labs typically are going to be normal, and the cause is typically going to be a direct extension of PID into the right upper quadrant of the abdomen. So what happens if I become pregnant? So there's going to be an increased risk of premature rupture of membranes as well as preterm delivery. Premature rupture of membranes just means that your bag broke prematurely before the baby has actually developed. Miscarriage and perinatal death was not associated with chlamydia. And including to all these complications, there's something called proctitis, which is going to be infection of the anal canal for women who practice receptive anal intercourse. Now, there's a big difference between women who practice receptive anal intercourse and men who practice receptive anal intercourse. We'll talk about that in men shortly. But in women specifically, the chlamydia will actually be asymptomatic, meaning that you won't have symptoms. The only complication is that, that women who have chlamydia anally will actually be a reservoir for spreading infection. What are the symptoms that men will display? So men will have urethritis, just as like as women. Now, men don't have cervicitis because they just don't have a cervix. Now, with urethritis, the rates can be up to about 96% that are asymptomatic as well. So men, just as well as women, will oftentimes be without symptoms. Now, if you do have symptoms, a lot of times you'll have a mucoid or wider urethral discharge. Discharge typically is clear and only seen with milking the penis, and may only be seen as well as stained garments in the morning. Dysuria is very common, meaning that you can have pain with urination and can be the symptom for chlamydia. Incubation period is going to be about 5 to 10 days after exposure, but again, if you are asymptomatic, you might have had the infection months to years prior. Another symptom can be considered epididymitis. The epididymis is a sac that is above the testicle that stores sperm and that can also be inflamed. It is most commonly found in sexually active men that are younger than 35. Symptoms include one-sided testicular pain. Ultrasounds can be ordered, but typically are not because they're not very helpful and do not rule out completely the possibility of having epididymitis. Including epididymitis, there's also what's called chronic prostatitis. The prostate gland is the organ that stores semen whenever ejaculation occurs, and that is also involved in infection as well. The symptoms include dysuria, meaning painful urination, and urinary dysfunction, meaning that you have to run to the bathroom with frequency and maybe sometimes urgency. There can also be pain with ejaculation and deep pelvic pain as well. Also, with women, men can also have proctitis. So it occurs mainly in men who have sex with men who engage in receptive anal intercourse. Now, there are different subtypes than women. They do have subtype D and K, just as women do, but along with that, there is what's called subtype L, which is primarily in men who have sex with men. Now, subtypes D through K, which is what we discussed with women, typically is going to be asymptomatic, and that can occur, but subtype L, which occurs specifically in men who practice receptive anal intercourse, that is very much a type of bacteria that actually cause symptoms. Symptoms of proctitis with this type of bacteria of subtype L will actually be anorectal pain, discharge, and sometimes tenesmus, which is just a very painful spasm of the rectal muscles. So rectal bleeding and constipation can occur, as well as fever and malaise, which is the overall feeling of being sick. L subtypes occurs most commonly in patients with HIV as well. Exam finding when you go to the doctor might include a very friable mucosal membrane, which means just a very irritable layer of mucosa, as well as polyps and just mucus, often misdiagnosed as inflammatory bowel disease. If untreated, can even occur in chronic conditions, including rectal fistulas and also strictures. Rectal fistulas meaning that there are holes that go from the skin to the anus, as well as strictures, which means that the anal canal has a lot of scar and will actually be very narrow. Subtypes D through K do not cause any symptoms. It's very important for men who practice receptive anal intercourse to have yearly screening, particularly in those who have HIV. Now, men and women can actually both have similar presentation of symptoms, including what's called conjunctivitis. The conjunctiva is the white layer on your eye that typically people know as, when it gets infected, as pink eye, which can be due to a virus. But in this situation, if you have direct contact with genital secretions that gets in the eye, then you can actually develop a pink eye, but not due to a virus, but can be due to chlamydia. So symptoms of conjunctivitis includes a pink eye that may not actually drain any pus at all. They may have a cobblestone appearance on physical exam. Pharyngitis, which is a sore throat, generally does not occur with chlamydia. Well, that's all the time we have for today. So if you're interested about how to treat chlamydia, be sure to visit our next segment on next week. Be sure to subscribe below. Like it if you like it, dislike it if you disliked it. And if you want to support us, be sure to support a cause. We are part of Unbound Now, which is an organization that seeks to release women from sex trafficking as well as other types of human trafficking. Go to the website that is listed below. It is unboundnow.org. And be sure to become more educated on the topic. Be sure to just know where your local chapter is. And if you want to provide a financial gift, then that is well received as well. So thank you for coming to my health spots. Be sure to come again and have a great day.